This green one in your packet or attached on the email, or I can email it to you, is our cancer policy. One out of every 2 men are being diagnosed with cancer today. If that is a concern for you, it's just a matter of time. It seems like if you're going to be diagnosed, I don't know if you're aware of this, but we're all born with cancer cells, and it's just a matter if they activate or not. So I'm going to, again, go over the green cancer policy. I will not go in every detail. There is a lot of details in here, but definitely look at this if cancer is a concern for you or something extra you want to protect. But every policy, we do have multiple policies we offer. I'm going to go over our cancer level 2 policy. This policy is going to pay you for a cancer screening once a year per member in your family at $75. So if you go in and you have your yearly woman screening, or you go in for a colonoscopy or a chest x-ray or any cancer screening, a biopsy, this is going to pay you $75 for one of those screenings per year. So I'm just starting at the top with this wellness benefit, and then there's a diagnosis benefit. So we are going to pay you $4,000 for diagnosis of cancer. This policy can grow by $500 every year you own it. So if you have the policy in 2 years, your policy is going to actually pay out $5,000 for cancer diagnosis. And then, again, I don't like to go through every detail. There is a lot of details on here, but radiation, chemo, hormonal therapy, there's going to be different payouts based on the type of treatment you receive. So, like, for example, for therapy, self-administer is $250 a month, where if it's physician-administered, you're going to get $1,200 a month. So there's a big difference in that. We do have surgery, anesthesia, there's skincare benefits, there's hospitalization. We pay $200 a day the first 30 days. After that, it goes to $400 a day. There's outpatient care, and it just goes on and on. Nursing care, breast reconstruction, etc. This is a really good cancer policy. Aflac actually started with their cancer plan. Now, let's say you have to go to the Mayo Clinic or somewhere over 50 miles from where you live. We do have a transportation benefit of 40 cents per mile round trip, up to $1,200 per trip. So Aflac, that's when it really does help out, because you can't take your health insurance card and swipe it at the gas station. So if someone was to be diagnosed with cancer in your family, you're going to probably be off work if your husband is sitting there diagnosed, or if it's your child, you're going to be there and you're not going to be working. And so health insurance just doesn't cover everything, and that's what this stuff is for. So we're going to pay you upon diagnosis. As long as it's internal cancer, skin cancer, you get a skin cancer benefit. And then there's also lodging care. So if you're staying in a facility, again, it's over 50 miles, and you're having to stay in a hotel for why immediate family member got treatment, we're going to help reimburse you for that lodging stay. And then it also will cover for any specified diseases. So some examples would be like rabies, West Nile, bubonic plague, cerebral palsy. There's a whole list of them, of like 32 different diseases. This policy will pay $2,000 if you're hospitalized or diagnosed for that. And then there's additional benefits you can see at the bottom, and that is an option to have on here just for a little extra coverage. Some people like to have that on their plan. But this is our cancer plan. As long as you're 5 years clear of cancer, you can still get the policy. So you're not totally opt out of this coverage. But yeah, that is our cancer policy.